Hi, everyone. Welcome to the All Things Amyloid podcast, where we feature patients, caregivers, and clinicians who discuss amyloidosis, a rare and incurable disease. Amyloidosis occurs when the body builds up abnormal amounts of misfolded amyloid protein, which can lead to serious and life threatening outcomes. I'm your host, Mackenzie, an amyloidosis patient and founder of Mackenzie's Mission. Our goal for this podcast is to raise awareness and share firsthand what it's like to live with this disease, to care for those affected by it, and to treat it. We hope this leads to earlier diagnosis and start of treatment, which will improve patient lives. The doctor patient relationship is so important to a patient's journey, especially when dealing with a complex disease like amyloidosis. Listen to Mackenzie, where she talked with Erin Poyant, founder of the hashtag HATTRNextGen and Senior Manager of Education and Awareness for the Amyloidosis Research Consortium, about how this relationship can be strengthened within the Black community. In this episode, Erin emphasizes the importance of addressing and mitigating biases in the doctor patient relationship to encourage positive communication and trust within the Black community. Erin, it's always great to have you.
Thanks, Mackenzie. I've been really looking forward to this discussion as well.
Absolutely. I've been looking forward to what I think is going to be a truly reflective yet forward thinking discussion about addressing some of the biases in the doctor patient relationship and how we can foster better communication and trust, especially within the Black community. So, today, we want to go deeper into how healthcare providers might unintentionally bring biases into their interaction with patients and how this affects care. So, what are some examples of how this happens?
Yeah, Mackenzie, it's a real issue and it can have a serious consequences. Even well-meaning providers can fall into the trap of letting their assumptions influence their judgment. This often leads to, a paternalistic approach where they think that they know what's best for the patient without fully listening, especially when it comes to discussing rare diseases like amyloidosis.
Absolutely. Would you mind sharing some of those experiences with us?
Sure. One significant challenge during my journey to discover my status with amyloidosis pertained to getting a prealbumin level checked. Prealbumin is often low in V122I carriers. So having that result as a baseline could be relevant to me. Despite it being a strong recommendation from an amyloidosis expert, I faced considerable pushback from my primary care provider. Even though my family history was well documented, my first degree relative had passed away from amyloidosis, I still encountered skepticism. And then when the genetic testing results finally came in, my primary care physician called me and said, Erin, unfortunately, it was positive. Good thing you advocated for yourself. Needless to say, it was incredibly frustrating because I shouldn't have had to fight so hard to be taken seriously. And I feel it's important to provide a second example here to show that these issues affect the Black community beyond just amyloidosis and rare disease. This happens regardless of age, class, region, or the specific disease or illness. For instance, when I was in my 20s, I was sent home from a regional hospital because they assumed I was a drug seeker. I wasn't looking my best. I looked like a total wreck, to be honest, but that shouldn't matter. I was sick, weak, and in tremendous pain. Those assumptions nearly cost me my life. I ultimately needed emergency surgery at a different hospital for a small bowel obstruction.
Mhm.
This illustrates how biases can impact medical care across different contexts and how providers letting these biases interfere with clear assessments, they lead to serious consequences. And to bring it back to amyloidosis, this could cause a delayed diagnosis and treatment.
Those are some really powerful examples, and I'm glad you shared them with us, Erin. You've alluded to this in a prior episode that mistrust in the Black community can't be assumed to be tied with historical events like Tuskegee or Henrietta Lacks. So, can you elaborate on that a little more?
Oh, yeah, absolutely. Mistrust in the Black community today is often rooted in how people are treated in the present, not in the historical events like Tuskegee. Let's think about it. In fact, many younger Black individuals wouldn't even know what that is referring to. Mistrust stems from experiences like mine, being dismissed, not listened to, and negatively categorized due to preconceived notions. It often feels like we have to constantly fight just to receive the care we deserve. The issue is how healthcare providers often interact with us in the here and now.
And that's a really crucial point. So, to build on that, what advice would you give healthcare providers to avoid these kind of pitfalls moving forward?
I think first and foremost, I want to acknowledge the incredible work that healthcare professionals are doing, often under very difficult circumstances. So, the intent here isn't to criticize, but to encourage reflection and growth. Providers need to approach each patient interaction with humility and a willingness to listen without letting ego or assumptions get in the way.
Mm,
Be culturally appropriate and aware for sure, but still treat your patient as an equal. There should be no perceived or actual intellectual hierarchy in the doctor patient relationship. The patient may not be a physician, but I can guarantee that they have a specific intellect, profession, or skill for which the healthcare professional may know little to nothing about. And you would hope to be treated with care and respect in that patient's professional environment. They should expect the same in yours.
absolutely. That really resonates and emphasizing the need for mutual respect and understanding in the doctor-patient relationship. You mentioned some difficult circumstances facing healthcare professionals. Perhaps we can touch a little bit on healthcare burnout. We're all aware that this is a real issue, but kind of tying these topics together, how do you think that burnout influences some of the issues that we've been talking about?
Yes, healthcare burnout is a significant issue, especially post COVID. I have a lot of empathy for providers who are under immense pressure, and I understand that burnout can make it harder to provide the best care. I think that's why it's essential to support healthcare professionals within the workplace. When providers feel supported and valued, they're in a better position to listen, reflect, and continuously improve their approach to patient care. And it's a win-win for everyone involved.
Absolutely. You're so right. And supporting healthcare professionals is key to ensuring that patient care doesn't suffer, even when burnout is a factor.
Exactly. Continuous self assessment and improvement are critical, even in the face of burnout. It's important not to let those pressures compromise patient care.
Mm,
By creating supportive work environments, we can help providers maintain the highest standard of care that every patient deserves.
absolutely. So to wrap up, how would you summarize the importance of effectively reaching, communicating with, and connecting with the Black patients in the doctor's office?
Reaching and connecting with Black patients requires understanding and respect. It means being culturally sensitive, but also ensuring that every interaction is grounded in equality. Healthcare providers shouldn't assume to know their patients better than they know themselves. Instead, foster a collaborative environment where the patient's voice is heard and valued. This is how trust is built, and it's how to ensure better health outcomes for the Black community and for all patients, really.
Yeah, thank you so much, Aaron. I think you brought forward some really wonderful points and suggestions for healthcare providers and to ensure that we do have better relationships and we optimize them to the best of our ability. So again, thank you for sharing your insights and your personal experiences with us.
As always, glad to be here. Thank you, Mackenzie.
Of course. So for all the healthcare professionals who may be listening, I hope this conversation encourages you to reflect on your own practices and to continually strive to be more empathetic and deliver patient-centered care. Remember that supporting each other in the workplace is just as important as supporting our patients. So let's work together to break down these barriers and build trust in every interaction. And just some key takeaways. First being, let's address biases and assumptions in patient care directly without judgment. Mistrust in the Black community is often based on current experiences rather than historical events. We should be emphasizing humility, active listening, and treating every patient as an equal partner in their care. We want to ensure there's no intellectual hierarchy that's felt in the doctor patient relationship. Respect should be reciprocal. Acknowledge the critical work healthcare providers do and the importance of supporting them in their roles to help manage burnout. Strengthen the focus on how to effectively reach, communicate with, and connect with Black patients in the doctor's office. And finally, continuous improvement in bedside manner and approach is crucial, especially in the light of healthcare burnout.
Thank
Thank you for listening to the All Things Amyloid podcast. If you find our podcast informative, please follow and share it with others. If you want to learn more about the work we're doing at Mackenzie's mission, please visit mm713.org. We'd also like to thank AstraZeneca Pharmaceuticals, Alexion Pharmaceuticals, Alnylam Pharmaceuticals, and Bridge Biopharma for their sponsorship to help raise awareness about amyloidosis. We hope you stay tuned for future episode drops. Thanks for listening.